Hi, I'm Dr. Anthony Azar. I'm Medical Director of Ageless Medical here in New York, and I want to talk to you a bit about your health. There are many conditions which human beings suffer with, some of which are really difficult to diagnose and even more difficult to treat. What's interesting is that these conditions were not lost on the ancients. The ancient Greeks, in fact, Hippocrates is noted as saying, "Let food be thy medicine." Here at Ageless Medical, we believe that a number of chronic and difficult to diagnose, difficult to treat conditions can be managed with intravenous nutritional therapies. And what does that involve? Well, it involves administering vitamins, minerals, and other supplements through a vein intravenously. When this is done, a number of interesting things happen. First of all, the role of the gut is bypassed. Oftentimes when you eat something or when you take something by mouth, what happens is it goes inside your body, but before that happens, it gets acted on by bacteria and other things that live inside of us. This bacteria can sometimes change the nature of what we're doing. In order to bypass that, we give this intravenously. Now, what type of conditions can we possibly hope to manage by this way? For example, chronic fatigue is something that is very difficult to treat and very difficult to diagnose sometimes. And we find that people do much better when they're properly nourished. And this is one application of intravenous nutritional therapy. The other thing that can be applied to are chronic infections. Oftentimes, people who harbor chronic infections become malnourished and don't even know it. It is sometimes difficult to diagnose malnourishment. The RDA values, or the recommended daily allowances, are the amount that you need to prevent disease, not the amount you need for optimal health. Here at Ageless Medical, we want to be sure that your health at its best. If your health is at its best, the body has the best chance of recovering on its own. And that is really the cornerstone of the philosophy of doing intravenous nutritional therapy, to give the body the best environment it can to help it heal itself naturally and without the use of too many medications. As we know, medications are very helpful for a number of people and could be life-saving in the right conditions. But you don't get something for nothing, and medications do have side effects and can be dangerous for certain people. So, our philosophy is if we can treat you with the lowest dose and the fewest medications as possible while resetting your body's natural ability to heal itself using intravenous nutritional therapy, then so much the better. Now, another problem that really is a scourge of modern living is cancer. And can cancer be influenced by nutrition? Can cancer be influenced by your environment? Or are you just a prisoner of your genetic makeup? Recent science has demonstrated that you are not a prisoner of your genetics. Your genetic information can be turned on and turned off based on how well nourished you are or how malnourished you are. Now, this is nothing new. You know, people hundreds and hundreds of years ago observed that patients who were malnourished usually succumbed or became sicker and sicker with whatever disease they had, while people who were well nourished had a better chance of recovering naturally. This is relatively new, and it's a fascinating area of discussion for which a lot of research is actually going on in, and clinical trials are actually underway right now. Of course, if you have cancer, you can't wait for clinical trials to be completed. So, there are a number of conditions which may be helpful if you consider the application of intravenous nutritional therapy. Obviously, this is not for everyone. However, it may be for you. If you have any questions, come see us, come talk to us. We will tell you what we think is right for you, and we will tell you what we think you should avoid. Again, with a moment for your health, I'm Dr. Anthony Azar of Ageless Medical, New York. Thank you.